Let's now focus on the major types of valvular disease and how they present, the types of murmurs and location where they are best heard, and the complications. Let's start with the mitral valve. Where is the mitral valve located? At the apex of the heart, between the left atrium and the left ventricle. That's why you will hear the low-pitched murmur during diastole when the atrium is trying to push blood forward to fill the left ventricle. Mitral stenosis commonly occurs due to stiffening of the mitral valve from scarring due to rheumatic fever disease, which is a complication from untreated strep throat or scarlet fever. Basically, some streptococcus antigen gets deposited around the valve. Antibodies come and tag them, and as invaders, immune fighters come in and start firing at them, killing them, as well as damaging the valve. The valve tries to repair itself by forming scar tissue, which stiffens the valve. Because the mitral valve is stiff, it will not open completely during diastole when the left atrium is trying to fill the left ventricle. Therefore, stiff mitral valve means that more muscle is needed to push blood through, so the left atrium hypertrophies or becomes larger, the muscles grow thicker and larger to compensate and match up the force or the energy required to push against the stiff valve. Over time, the hypertrophied muscle weakens and become less effective with pumping blood moving forward against that stiff valve. This means more blood will be sitting in the left atrium than usual, and then it starts backing up to the lungs. Because the lungs are congested with blood sitting there, patient will have difficulty breathing, pulmonary hypertension. Also, there will be a possible atrial fibrillation from the dilation of the left atrium. And fibrillation, AFib means a risk of PE and as well as risk for stroke. And in worst case scenario with pulmonary hypertension, the right ventricle will have a hard time pushing blood forward to the lungs for oxygenation. This can cause right ventricular heart failure or cor pulmonale. Mitral regurgitation. The mitral valve does not close completely when it's supposed to during ventricular systole. Therefore, when the left ventricle contracts, leaking valve causes return of most blood or stroke volume to the left atrium. More blood sits in the left atrium, and this time the left atrium will dilate and not hypertrophy. It dilates because the muscle needs to overstretch and accommodate more blood volume, some coming in from the lungs and some backing up from the left ventricle due to the leaky mitral valve. Over time, the stretched, dilated left ventricle becomes too much and weakens the muscles of the atrium, causing backflow of blood to the lungs. So you will hear a holosystolic whooshing murmur radiating to the axilla or the armpit. So this is a good common exam question. Which murmur is a holosystolic whooshing sound that radiates to the axilla or the armpit? That is your mitral regurgitation. And the holostatic murmur, meaning throughout the entire left ventricle as it goes in through the systole or contracts, the murmur will be present. As long as it's contracting, the murmur will be present. So it's a holosystolic murmur. Common causes of mitral valve regurgitation is mitral valve prolapse from myocardial infarction leading to papillary muscle rupture due to ischemia. And that's why when a patient has signs of angina that does not go away with nitroglycerin, it's very emergent because we call it acute coronary syndrome because it can lead to some of the muscles or some parts of the heart dying. For example, the muscle around where the papillary muscles tendons hold on to the walls of the heart, and therefore, because the papillary muscles are the ones that hook onto the mitral valve and helps to pull them to open and close. So imagine if they are dead, so that means that the mitral valve does not have that support. So it can cause mitral valve prolapse, which is also called mitral valve regurgitation. A less common cause for mitral valve regurgitation is Marfan syndrome, which is a degenerative disease of the connective tissue. Complications of mitral valve regurgitations include backflow to the lungs, which will cause difficulty breathing due to pulmonary hypertension, Left atrium will dilate, overstretching, which can cause arrhythmias like AFib or A-flutter. Basically, dysrhythmia puts the patient at risk of stroke because they can throw off some emboli. And since less blood is ejected out of the left ventricle to the rest of the body, expect to see signs and symptoms of hypotension and hypoperfusion.